I am excited you are here today. Do you know why?
Why is that?
Because we're talking about coronary artery calcium score, which is one of my favorite topics. I know you have to be a true nerd to love to talk about coronary artery calcium scoring, but this is something we get tons of questions about. There's a lot of uncertainty. I get a lot of questions about this from doctors, as a matter of fact. So
Oh,
Ryland, I'm
wow.
really curious, when do you recommend a coronary artery calcium score?
When the doctor does.
Yeah.
When
Okay.
you do.
Okay, even better. I like that. That's a more specific answer. Like you would have got a C+ for the first answer, but an A+ for
Yeah.
the second answer.
Yeah,
No, I'm
exactly.
kidding a little bit, but the point I want to make about that, well, Ryland didn't go to medical school, but even for people that did go to medical school, doctors, there's a lot of uncertainty about when to do a coronary calcium score. And then what we're going to focus on today is what to do with those results. And so, as you can imagine, if there's a lot of doctors out there that aren't really sure about its role, then what are patients supposed to do? So today I want to simplify that. I want to cut through a lot of confusion, break some myths about coronary calcium score, and give people actionable advice about what to do with a coronary calcium score. So, I might start with this, is when do you do a coronary calcium score? Like, why would that ever be a consideration? And I'll try to put this in a nutshell. We can talk about this in more detail at another time, but basically the reason that coronary calcium scores are potentially valuable is that they give very specific information about that individual's heart disease risk. So let me break that down just a little bit. We have tools to assess heart risk, but those tools are algorithms that are really great in populations, but don't have much relevance often to an individual. We understand that there's a bell-shaped curve of data here, and where that individual sits is really anybody's guess. And what the coronary calcium score does is it takes all that information about your unique genetics. How did your unique genetics interact with all those 200 plus risk factors for heart disease, and give you your amount of calcium from 0 to whatever that number is. And then from that information, we can then have an objective, individualized, personalized assessment of what your risk is. So that's question number one. Why do we do coronary calcium scores? Because we want to individualize your risk for future heart disease. Here's the next part of that. So why is that important? Why do we even want to know? And we wouldn't want to know if we couldn't do anything about it. Like if I just did a test and said, hey, Ryland, you're at high risk for future heart disease. Best of luck to you. Maybe go buy some life insurance. That's not really valuable, but that's not the case at all with heart disease, because when we know the risk, when we know that risk is high, we have really effective ways of lowering that risk. And, national data suggests that we could lower heart disease by 80%. I will tell you my experience as a preventive cardiologist is that when I have a patient who's engaged, who's coachable, who is willing to do the things that they need to live a long, healthy life and avoid heart disease, and they're following my guidance, we're working together as a team on this, I think that percentage is even higher. Like I know there's no guarantees in life, but this is pretty good guarantee. Like I think those are the people that they just don't have more heart disease in the future. Like we are able to stop that. It's the people that either don't know their risk or don't do what they need to do to lower that risk. Those are the ones that call me later and say, hey, I'm having more chest pain, or I get a call from the emergency room saying your patient's in the emergency room. So that's why coronary calcium score is so important, is because it helps us identify your individual risk. So does that make sense to you, Ryland? Does that help answer your questions about why we would want to do this test?
Yeah, and that's actually really helpful for me too, and just answering questions, since we're talking to people about this stuff all the time, prepping them to understand what you're going to talk about, when you meet with clients individually. It's really important to have that background knowledge and that understanding of the importance of a coronary artery score. And if you guys have questions here on this talk, feel free to leave some in the comments. We'll be happy to answer them. And I'm curious, like, how many of you guys have been, or your cardiologist or your doctor, how many of you guys have been suggested to get a coronary artery scan, and how many of you have? Leave a comment, let us know. And if you have questions, feel free to let us know. Of course, we can't give you medical advice, but that's what we're here for. So thank you, Dr. Hurst.
Yeah, so really good point. And I see coronary calcium scores being used appropriately, of course, but then a lot of times I see them being used inappropriately, meaning that they're being done for reasons that don't add anything to the decision making for that patient. Whether they're being done because a patient's risk is already identified, like we already know they're high risk for future heart disease, then a calcium score doesn't help us any, or we already know they're very low risk, then there's no reason to do those tests. But let's now focus on the people that have had a coronary calcium score. They've received the knowledge, they've received the report, and they've been told you have a high calcium score. What does that mean? Like what should we do about that? So
yeah, and if you're thinking about getting one, listen up too, because this can be useful information for what to do once you get that information back.
Beautiful. So having a high calcium score is a very concerning thing, because what we know about having a high calcium score is that those people are at high risk for future heart disease. Heart disease, stroke, not quite as much, but certainly for heart attacks, and then death from heart disease. So the higher the score, the higher the likelihood of future risk for heart disease and strokes and death. And that's, of course, a very concerning thing. Nobody wants to find out that they are at high risk for the number one cause of death and disability in the world. But what I'm going to show you, what I'm going to talk about today, is that actually this is a blessing. Like, this can be an opportunity for people, because knowing their risk can give them the information they need to avoid that risk. So a calcium score is not the fate's already decided. Like, oh, I have a high calcium score, I don't have any options here. Actually, the opposite of that. When you know that you're at higher risk, that's when you know what your options are. You know how aggressive you need to be in regards to your prevention and to your treatment regimen. And when you have that information, you're working from a set point of knowledge, not from a set point of ignorance, which is critically important in this. So let's talk about a couple of the myths around coronary calcium score. So, one thing that I kind of alluded to earlier was that calcium scoring being done in inappropriate situations. And one way that I see this being done that doesn't help is when high calcium scores are being repeated in the future as a measure of the effectiveness of that person's prevention strategy. So, I understand where the concept comes from. Like, you find out you're at high risk for future heart disease. You start, doing everything that you need to do to lower that risk. You're healthy nutrition. We know what these are, right? We talk about them all the time. It's our message is heal your metabolism. It's get your blood pressure good, your cholesterol, your blood sugars, get your weight good, be physically active, eat nutritious food, manage stress, sleep, avoid toxins, stay connected. Like, those are the 10 things that heal your metabolism and also lower your future risk of heart disease. And we'd like an objective measure of that, like some kind of, hey, you're doing a really great job. And it makes sense that, on the surface, if a calcium score has been high in the past, well, if I do all the right things, then the calcium score is going to get better. But the reality is the calcium score is not going to get better. It is going to universally get worse over time. Like, there's some variance there, and sometimes I've had people that have had, oh, well, see, my calcium score repeated 6 months later was better. But what it happens is that, okay, that's just in the variance of the test. They do it a couple more years later and it's even higher than it was. So whether you do the wrong things or the right things, your calcium score is going to get worse. That's not what the role is. The role is to say, what is your risk today? So if you have a high calcium score, the answer's answered, or the question's answered. You know that you're at high risk. You need to be aggressive with your prevention regimen. Now, if there's a calcium score that's 0, then that's a different situation. That's where a patient and doctor really need to talk about the other factors, because this is just one tool in the toolbox to assess risk. And in some situations where that risk score is 0, a doctor may say, hey, let's repeat this down the road, maybe in 5 years, maybe in 10 years. That's not an unreasonable thing, but that's something that a patient and a doctor need to talk about with themselves. So that's myth number 1, is that the calcium score is a tool to measure the effectiveness of your prevention. Absolutely not true. And definitely, if you've had a high calcium score, I can't imagine a scenario where repeating that would make sense for the future. So the second myth I want to talk about with high calcium scores is that a high coronary calcium score means blockages in heart arteries. And this is a tough one, because we're measuring kind of the same thing here, at least by this description. One, we're saying how much artery disease do you have, and we could look at that from a calcium score standpoint, or we could take a look at that from a blockage in artery standpoint. And what's important to know is that you can have a lot of artery disease, but it's not resulting in blockages to the artery. A lot of that artery disease can be outside of the vessel wall. It can narrow the vessel, but it doesn't actually perform or create a blockage in there. So there's not great correlation between high calcium score and blockages. And that's where oftentimes patients get confused. They think, okay, well, I have a high calcium score, I must need a heart catheterization and a bypass surgery and a stent. That's not necessarily true. That's where you need to talk to your doctor about this. But I just want to emphasize, these tests are measuring 2 different aspects of artery disease. Calcium score is what is your risk? And it's really good at that. Not is there blockages. Stress tests, angiograms, those are, do you have blockage in your arteries? That, though they're not great at long-term risk assessment, but they are really good at evaluating for blockages that may be causing lack of blood flow and symptoms like chest pain or shortness of breath. So two different assessments of artery disease, both with their role in taking care of people with future heart disease. So now I want to switch to, okay, well, what's the most important thing you need to do if you have a high calcium score? And a lot of people will think, oh, well, I need an angiogram, or I need a stress test. And sometimes those might be right. You need to talk to your doctor about those. But I'm going to argue a different point, that if you've had a high calcium score, what that means is you are at higher risk than anticipated for future heart disease risk. So what's the most important thing you can do? Lower your risk. And Ryland, how do we lower the risk of future heart disease?
The 10 essentials.
Yeah, so we heal the
Healthspan
metabolism,
10.
right? We do that with the Healthspan 10. So and why do we use the Healthspan 10? Why this isn't something that I just made up and said, oh, this sounds good to me. Like, this is the best research out there. It is the 7 factors. American Heart Association calls these Life Simple 7, that we know from multiple research studies, people that check all 7 of these boxes, they optimize these 7 things, they have 80% less heart attacks than those who don't. They also live 12 to 14 years longer than those who don't. It makes sense then. Where are we going to start with lowering our risk for heart disease? We're going to start with the proven methods, Life Simple 7, and that is simply good blood pressure, cholesterol, blood sugars, body weight, avoiding toxins. And the research studies, that was simply just not smoking. But in our program, we have a more broad view of toxins, because there's other toxins out there than that. I got stuck on, nutrition, eating healthy diet, and then physical activity. So those are the 7 factors that the research tells us lowers the risk of heart disease by 80%. But wait, there's 10. Wait, what do you mean? I thought we were on science here. The reason is because I have been a clinician for a very long time. I know the research data. You know this as well. Sleep, stress, being connected, those are as important as any of those other 7 things. And when you optimize all 10 of those factors, that's the most important thing you can do. When you have a high calcium score, that's the opportunity. This isn't necessarily a bad thing, a bad thing. Why we're going to find out what your risk is for heart disease. One is we can do a calcium score, and we can find out early, before heart attacks, before symptoms, before the damage is done. Hey, you're at higher risk. We need to optimize your prevention and get those numbers really great. Or the other side of this, and what happens far too frequently, way too much, 800,000 heart attacks a year in the United States, about 300,000 people die from sudden cardiac death every year in the United States. That means that with very little warning or no warning, they just drop dead. That was their first sign of heart disease. It occurs in about 25% of the time. For people, their first sign of heart disease is they die. That's the bad way to find out you have heart disease. This is the good way. So if you have that high calcium score, I understand you first look at it and you say, oh man, I don't know how, this isn't great. I'm not happy about this result, but flip that around, because this is your opportunity. This is your chance to change that trajectory and optimize your prevention. And I will say again, we're really, really good. When you buy in, your doctor buys in, when we're all working together as a team, that's when great things happen. That's when we really save lives. So that's my kind of take on coronary calcium scores. I actually love seeing patients for high calcium scores, because a lot of times they've gotten misinformation. They've been told that they need, an angiogram, or they need a heart catheterization, or they need to take aspirin, and all these things may be true. But mainly what they are is they're scared to death. They're like, oh my gosh, I'm worried about this. I'm really, frightened about my risk for future heart disease. Oftentimes they have had experience with people with heart disease. They know that they don't want to go down that path. And it's just so gratifying for me to tell them, say, look, this is an opportunity. Like, this is a great thing now, because now we know, and now we know what to do to get you back on track and avoid that future. So that's my that's my excitement about coronary calcium score, and why I think it's a great tool in selected people. Not everybody should get this. Certainly not if you've already had heart disease. You already know you're at very high risk. There's no rule for coronary calcium score. But if you are uncertain, or your doctor's uncertain, or you're both uncertain, then a calcium score might be the right thing for you. So does that make sense, Ryland? What questions do you have, or any questions from our audience that have come up?
Yeah, and if you guys have a question, you still have an opportunity to type it in the comments there. But I really loved what you said about it's not detrimental, it's an opportunity. Like 20%, that blew my mind. 20% of people find out that they have heart disease by dying. And that's really scary. So, if there is a concern there, you need to go get tested. Don't be afraid of what the score is going to be, because that creates opportunity, that creates motivation to start doing those 10 essential things and start, optimizing your lifestyle so that, you can add years to your life and create longevity. And if you're more interested, Dr. Hurst has written an entire article for you, and he offers it for free download. I put the link in the description, but it's healthspanMD.com/10, TEN. if you guys want to get that guide on the 10 essentials. But I just loved what you said of it's the opportunity, because I think a lot of people are so nervous to even get it or ask about it, because it's like, oh my God, what if I find out? But it's necessary to know, and then assess the opportunity you have to move on from here. And you don't want to face that unfortunate reality that is 20% of people having heart disease find out with death.
It's a natural human thing. You know, we have fear, right? Like, I have it, I'm sure you have it as well. Like that's a natural tendency. But you know, what I think we're emphasizing here is that the fear is we're going to find out something that we don't have control over. I understand that fear. Like in those situations, you're like, well, I don't think I want to know, right? Like it's not going to change anything. All it's going to do is make me worry. Then I don't even want to know that. But that is not the case when we're assessing the risk for heart disease. You're finding out so that you can be proactive, so that those things you worry about, like the things that wake you up in the middle of the night and you're thinking, oh man, my mom or my dad or my brother or, you know, my uncle or whatever had a heart attack at the same age I am right now, or just 10 years older than where I'm at, or whatever that thing is. Or maybe it's somebody, you know, that's similar age, or you know, and they seem to be in great shape and they had some heart problems, and you're waking up in the middle of the night saying, well, what if that could be me? This is an potential opportunity to do something about that and avoid that. And hopefully you get a calcium score that's great. Like it says, you're doing really well. Everything's fine from a heart standpoint. And if that's the case, I'm really happy for you. But you know, if you're concerned, why you make that decision from knowledge, not from ignorance, because that happens way too often, that people just didn't know what they needed to know at that time. Because if they did, they would have made different choices, made different decisions. Oh, you're on mute, I think. There
Sorry.
you go.
And side note, even if you know, your calcium score is great, everyone can benefit from the 10 essentials that Dr. Hurst has put together. So
keep it great. That's right.
Yes, keep it great. So a couple of questions from the audience, Dr. Hurst.
Sure.
And Craig had mentioned he had a good calcium score, 0. But he was asking about, you know, it doesn't detect soft plaque. Is there any way to detect soft plaque? And if so, is there a way to treat it?
Yeah, so that's a really great question, Craig, and one that I think about a lot. So let's talk about what a calcium score is a little bit. So the calcium that shows up on a coronary calcium score isn't really what the worry is. Like the calcium's not the problem. It's what it's associated with, as you so astutely noted, is it's the soft plaque that's associated with the calcium that is the real worrisome thing. Because the way most heart attacks occur is that soft plaque ruptures and forms a blood clot, and that blood clot blocks blood flow through the artery, and a heart attack happens after that. And so you're exactly right. A calcium score of 0 is not a an ironclad guarantee. Depending on the studies, a calcium score of 0, those people can have 4 to 5% heart attack risk in the next 5 years. Well, that's not exactly low risk. There are people that are still have concerns about their event rates. But the point of it is that that's a lower risk than if it's a high risk. So I think your point is a good one, is that when the calcium score is high, that's definitive. We already know you're at higher risk. Here's what we need to do about it. When it's 0, then that's one where there's more open for debate. And as I mentioned before, the calcium score is a tool, one tool in the toolbox to evaluate things. And so if I see a patient who comes to me with a calcium score of 0, but I know they're at very high risk still, like they have, a cholesterol levels that's through the roof, they have diabetes, they have, other factors where a family history that I'm really concerned about, I talk to that patient and say, look, I'm glad your calcium score is 0, but that does not mean that we shouldn't aggressively treat these other 10 factors. We need to do that as well, because we want to keep that calcium score 0. So as I mentioned in the beginning, if I already know your risk, I don't want to do a calcium score. I'm not going to recommend that. And so the most obvious example of that is somebody who's already had a heart attack, had a stent put in, had a bypass surgery. We already know they're at high risk. We don't need a calcium score to help them. If I already know that you have diabetes, you have a really bad family history, you have a really high cholesterol, I don't need a calcium score. I know your risk is high. We need to address those issues. But where the calcium score is helpful is I'll give it a scenario. So let's say that it's somebody who has a family history of heart disease. Kind of early, but not shockingly early. They're doing all the things they can to prevent a future heart attack. They're physically active, they're eating healthy, they're normal weight, their stress is good, their sleep is good, they're not smoking, all of the factors that they can do, but their LDL cholesterol is in a gray zone level. Like it's, maybe it's in the 120s or 150s or something like this. And they're saying, I don't know if I got the bad genes or if I got the good genes in my family history. That's where a calcium score can help them. The calcium score could help them make that decision of is my cholesterol okay, like where it's at? And can I wait a while? Can I wait 5 years before I think about evaluating that again? Or do I already have early warning signs that I have the bad genes, that I need to be super aggressive with my prevention regimen? That's when the calcium score is most helpful. So hopefully that answered your question, but that's a great, very insightful question. And I'm glad your calcium score is 0.
Yeah, thanks, Craig. And if you have any questions at all, please feel free to reach out to me on Messenger. This goes for everyone too. If you have private questions, I'm always available. Reach out to me on Messenger. I'm the best way to get to Dr. Hurst. So let me know. And we can talk more if you need help. One more question, Dr. Hurst, if you have
Sure.
time. So this is from Noreen. Any benefit to this test for AFib patient with no known risk factors or symptoms or test results indicating heart disease?
So again, if we know your risk, so if you have no risk factors for heart disease, which would be a pretty rare thing, like being over the age of 45 is a risk factor for heart disease. If you're male, over 55 for female, any family history. But if you have no risk factors for heart disease and atrial fibrillation, then very unlikely a calcium score is going to be helpful. I'll also point out that I'll point out 2 things, and I say this every time. This is on the end of our videos, but I just want to say it again. This isn't medical advice. I'm not giving anybody individual medical advice. That wouldn't be fair to you. It wouldn't be fair to me. What I'm doing is giving you general information that you can use to go to your doctor, because the nuances of this are very profound. Like sometimes there's factors that you may not recognize as a patient that the doctor is going to see as really significant. And I had that scenario today. Somebody came and asked, said, well, hey, can I just ask you some questions about heart disease? Would you be willing to see me and just give me some general advice? And I said, no, because that's not in your best interest. I need to know all of your information. If I'm going to be your doctor, if I'm going to give you doctor advice, you and I need to sit down and talk face to face. I need to look at all of your information, because if I don't, I may not give you the right advice, and that's not fair to you, and it's not fair to me as well. But back to this point, I think a calcium score in young people, that's open for interpretation. But in general, I'd say for men, certainly less than 40, women less than 50. I think a calcium score is of limited value, because oftentimes those people haven't had time to calcify yet. They can have a lot of soft plaque, like Craig had mentioned earlier, and it just has not calcified yet. And I actually had a research study that looked at this in the day. We looked at people that had calcium scores of 0, but then we looked at their neck arteries, the carotid arteries, with ultrasound, and we found that 38% of those people had advanced artery disease on their ultrasound that didn't show up on their calcium score. And it was, and again, this is hypothesis. I don't know that this is true, but it makes sense from the physiology. it's because they were young. They haven't had time to go on to calcify yet. So I think the age you are at has some relevance into whether a calcium score is a good idea for you as well.
Yeah. And does AFib, just a question, to go along with this, is AFib, play a role in this? Like if there's an AFib patient, is that immediately like we need to check your calcium score?
So they're often correlated. It's not cause and effect, so it's not, and there's a lot of nuances to this. Like, AFib could cause your heart rate to go really fast, which could cause a type of heart attack that's a demand heart attack. It's not the typical plaque rupture one. But if we're talking about traditional heart attack, the plaque rupture forms a blood clot, atrial fibrillation doesn't necessarily cause heart attacks like that, but oftentimes the people with AFib have the risk factors for artery disease as well. High blood pressure, high cholesterol, smoking, obesity, all of those factors, diabetes, prediabetes, an unhealthy metabolism, those factors predispose people to atrial fibrillation, but they also predispose people to heart disease. So they do commonly coexist, even if they're not cause and effect.
Gotcha. That makes sense. Well, are there any other questions today, everyone? Let us know. Otherwise, you can always view the replay later on, share it with your friends or family members that, might be in a similar situation, either considering getting a CT, coronary artery score, or, someone who's already had it and maybe is a little bit worried about the results. So yeah, feel free to share this info with them. The replay will be posted to the group as always. And if you have any more questions for me, it doesn't look like any more are coming in right now, but feel free to type them in the comments even after we're off the live video, and we'll do our very best to get to them.
Absolutely. And so calcium score today, and then in 2 weeks, we are back again, and we are going to talk about pre-diabetes.
Cool.
So Ryland, what percentage of adults do you think have pre-diabetes?
What percentage? I'm going to say it's probably higher than I think. 30%?
Yeah, 38%. So 38% of people. So it's about half now of people have high blood sugars, whether it's diabetes or pre-diabetes. This is just increased at epidemic levels. And there's a lot of misinformation about pre-diabetes. And what I want to talk about next, I guess in 2 weeks, we're going to talk about this, is what you need to know, the 3 things that you need to know if you have pre-diabetes that probably your doctor hasn't shared with you. So I look forward to people joining us next or in 2 weeks for that topic, pre-diabetes.
Yeah, we hope to see you guys there. Of course, we'll send out invites via the Facebook group, and feel free to invite any friends to the group and family members that might benefit from this as well. Everyone is always welcome, of course.
Absolutely. All right. Well, great seeing everybody, and look forward to seeing you in a couple weeks. This information is for educational purposes only and is not medical advice. Don't make any decisions about your medical treatment without first talking to your doctor. Thanks for watching. And if you want to learn more about living a long, healthy life you love, click the link below to learn more about how we help people increase their health span. And if you like this video, hit the like button below, share it with your friends, and be sure to hit the bell and subscribe.